welcome everyone. So this event, Writing for Wellness, is a bit of a combination event organised by a number of different groups. So I'm here representing the Oxford Centre for Life Writing and also Oxford Writing Mentors, which is our sister organisation. So if you've come through one of those organisations, welcome. And I'm also here as the rep for the Society of Authors in Oxfordshire. So this is listed as an Oxfordshire event. So if you've come through the Society of Authors, welcome from that side of my hat. We're obviously working in partnership with Goutham Rao, who's from Case Universities. I'll let you introduce yourself properly in a moment. But this is really his initiative, and he's got in touch with us to say, could we put on something together? And it's very similar. We do run a number of our own writing groups as well, which I would encourage you to find out more about. We're just a couple of weeks off the start of term in Oxford. So from the 14th of October, all our groups start up again. We have a feedback group, a writing discussion group, and then in Oxford and online, we have lots of author talks and book launches and interesting things going on. So do find out more about that. But without further ado, let me hand over.
Thank you.
And Goutham will introduce the session properly. Thank you.
Thank you. So let me first start by thanking Alice for bringing us together, and I really appreciate her enthusiasm. Unfortunately, we weren't able to meet in Oxford. I was there for a couple of weeks this summer for other business, but hopefully we'll be able to do that soon. Let me start by sharing my screen. I do have some slides to share. And please let me know if you can't see those. Okay.
Yeah, we can see that, but we can see your whole, there you go, perfect. Thank
there
you.
we go. So this presentation is entitled Words for Wellness, and I didn't anticipate so many participants, which is wonderful. So I've incorporated a very small interactive component in it. My name is Goutham Rao. I'm a professor and chairman of the Department of Family Medicine and Community Health at Case Western Reserve University here in Ohio, in the United States. I've had some connections to Oxford for a very long time, I think more than 20 years, with the Center for Evidence-Based Medicine, the Nuffield Center for Primary Care, things that most of you have probably never been to. And also I'm an editor at Oxford University Press, which I'll talk about in a moment. The title of this is Words for Wellness, and I want to give you some background as to how this came about. First of all, the idea of writing for well-being is not original. Certainly doesn't originate with me. In fact, Santiago Ramon y Cajal, who was a neuroscientist and winner of the Nobel Prize in Medicine in 1906, he was a physician as well, wrote fiction to take a vacation from the rules of scientific writing, which I understood, so that he could consider the future of science. That part I'm not too clear about, but nevertheless, he did write some mystery novels and was quite reputable in that regard as well. So he did it as a form of therapy, I think, and as he specified, as a break from his scientific work. Who am I? I'm a physician and I'm a health services researcher as well as a medical educator. I'm editor-in-chief of Family Practice, which is, if some of you are in Oxford, it's just up the road, Great Clarendon Street, from Oxford University Press, and I've been doing that for about 2 years. I've been teaching scientific writing for nearly 25 years, and I'm a longtime nonfiction author, and I'll explain why that's relevant in a moment. So I'm the author of 4 nonfiction books. The first one, Primary Care Management, which actually did quite well in the UK, introduces interesting stories of patients first, their life story, their circumstances, before tackling their medical issues. And the idea is that if you get to know a person really well, you are able to better take care of them from a medical decision standpoint. The subsequent books, I was the director of a pediatric obesity center, and I teach clinical epi and biostatistics. Those came later on. And next year, we will be releasing the Biomedical Writer's Handbook from Oxford University Press, which is all about how to write clearly from a scientific standpoint. None of this is too terribly relevant to our conversation, but it tells you that this was my focus for the first 20+ years of my writing career. Many of you heard, and I know some of you are healthcare professionals, about the problem of burnout, which really came to the forefront well before the pandemic, about 5 or 6 years ago. And this was a problem in the UK, it was a problem in the United States. You heard about physicians and nurses and healthcare professionals burning out, which has very specific definitions: emotional exhaustion, depersonalization, a lack of feeling of accomplishment. And healthcare systems in many parts of the world were beginning to assign someone to tackle this. Typically, this was someone with the title of Chief Wellness Officer. Now, our CEO felt it was not necessarily the best title, so he gave me the title, and I was reluctant to take on this role. I had no experience with it. As Chief Clinician Experience Officer, the goal was to tackle burnout and development of programs to promote well-being among healthcare professionals. That was it. So I did what I could. We created some community building events. We started a newsletter to summarize the achievements of junior faculty members. So if you're starting out in your career and you've written your first paper, that means a lot to you, but somebody's got to recognize it, for example. So we did things of that sort. We had a confidential hotline for physicians and other healthcare professionals who were having serious personal difficulties. And we had a peer support program, which all of this is completely confidential. So if one of your patients dies or if you've suffered some other sort of trauma, can you talk to a peer confidentially to get some assistance and some counseling? All of those were fine. And of course, this was all going quite well. And then this happened to all of us. And I will tell you that I don't think I will ever be the same again. I can't tell you how impactful it was. I don't think our world will ever be the same again. There was a point at which the general rule was in our healthcare system that if you weren't seeing patients, please stay home. And that applied to me as a chair. I thought I was exempted for a while, but no. And I only see patients 2 days a week. So all of a sudden I had all this time where I was doing a lot of Zoom meetings. My lengthy commute, I live in a village outside of Cleveland, nearly 1 hour away, was suddenly gone. So I had all this time. So what did I do? I started to write novels. The first one was published in 2021. It was Rainy Day Comrades. And it's not very medically related, but it does deal with the struggles of a middle-aged man who through life who moves to Chicago. The second one that's coming out, wrote 4 novels. 2 will be published. Is about a man who's struck by lightning and discovers his love for the piano, but that'll be coming out in May of next year. But the more important point is I found it incredibly therapeutic. It was a very challenging time in my life for many reasons. And to sit down in my office and to pen a chapter brought me a sort of peace and comfort and helped me cope with a lot of the other stressors in my life in a way that I never anticipated it would. It was almost a serendipitous discovery. I could have done something else. And as many of you know, many people turned to baking, music. I don't know what else they did, but during that difficult time, writing was what helped me get through life in general. So I started to think, if this is true, does creative writing in particular have some sort of therapeutic effect? Does it allow us to deal with the stressors in our life? And is there some literature around this? And there is, however, it's quite limited. So first of all, there's a literature around emotional processing writing, which for those of you who are not familiar with it, deals with writing about traumatic events in one's life. So it allows you to process exactly what happened and to cope with them better. So there is something available to that. Now, that's not unique to creative writers or to healthcare professionals or anyone else. So it could apply to anyone. There is a limited number of programs for healthcare professionals about creative writing. So there's a physician writing workshop at Yale. This has been around for about 20 years. It's only available to trainee physicians. And there is some evidence that it helps them in terms of expression of empathy and that it helps them to continue writing. Now, this is all based on self-report, so these are not really robust outcomes. There's some other evidence as well. This is an article on combating professional burnout through creative writing by Megan Cronin, who's a dermatologist in Florida. But again, this is just simply her opinion that she has found this to be therapeutic. And the problem is there any theoretical basis for why this might work? And she points out quite clearly that there's no real theory behind it. It's just it's an instinct. It's because expressive writing occurs on multiple levels: cognitive, emotional, social, and biological, making a single explanatory theory unlikely. In other words, there's so many ways in which creative writing could be therapeutic. There's no single explanation for it. And of course, that probably varies a lot from individual to individual. So this is another article called Creative Writing as a Medical Instrument by Jay Baruch, who's a physician. And his theory is that you can understand patients' stories and then write about them, in almost like a creative nonfiction modality, and that would help us to understand the patient a little bit better, which was kind of the original theory behind my first book more than 20 years ago. So if this is true, there's a sound basis for it, and we probably should expand it. Now, I also discovered a couple of years ago a conference run by the University of Arizona here in the United States on writing and well-being. I spoke at the conference last year in Arizona. Next year's, for anyone of you who are interested, will be held in New York City. But it's a similar sort of thing. Various theories, some original studies around it, and some workshops. So it's an interesting mix of activities at this conference. I encourage you to take a look at it as well. So I had reached the point where here I have this title, Chief Clinician Experience Officer, in addition to being a chair and a practicing physician and researcher. And I have discovered enough evidence to support the idea that creative writing could be beneficial. So what do we do with that next? You start some sort of group, right? And I can tell you, and many of you probably feel the same way, if we were to tell you that at 7 p.m. today in Oxford or London or wherever you happen to be, we've got a group of people that are getting together to discuss creative writing and perhaps complete some exercises for the purpose of dealing with the stressors in your professional life, the turnout would be extremely low. It would be extremely low here, and it would be slow everywhere. At the end of a long day, I don't want something that is supposed to help me deal with my professional life. I just want to go home and relax with my family or whatever. I want to listen to music. I don't want to concentrate. So that cannot be the mission, the sole mission behind it. There's many of these programs around. So as Chief Clinician Experience Officer, you can say, okay, well, we're all going to have some music therapy, and this will help us. Well, then, but you've got to attend the music therapy. You've got to make time for it, and you've got to believe that it would be beneficial. So we adopted a very interesting mission for our group, which, as you know, we've called Words for Wellness, and it's to learn, number one, and we'll get back to that very important point, to share, which we do a great deal of, to grow, in other words, to improve, and to find peace. So the find peace is only one part of the mission. The rest, I think, is more important. Some of you are physicians and other healthcare professionals. We know what we are, an obsessive compulsive group. We like to accomplish things. We like to learn things. If we're going to do baking or cooking or whatever, it's got to be a serious course that you take and you get a certificate and you feel good about it. That's just the sort of people we are. And that's the sort of people that any sort of creating writing group that targets this population attracts. So writing, you have writing for well-being in a very narrow context. In other words, I can say, for example, I want you to get together, let's do some creative writing so that you can process some of the emotions that come up through your busy day. But most of us want to write to add a different dimension to our personal and professional lives. So it's fun, it's therapeutic, but I really want something in paper, and I want other people to read it, and I want to have that sense of accomplishment, because this is something I feel I can do. Now, there's a problem with that, and some of you are familiar with Somerset Maugham, who was a physician and novelist with a fantastic reputation. And nobody is certain if this is a true quote or not, but it certainly sounds. It's also been attributed to Abraham Verghese, who some of you know is a novelist based at Stanford. I'm still part of the Stanford's, the group that he'd started there called Stanford Pegasus. But supposedly Somerset Maugham encountered a colleague who was a surgeon, and this is in Britain, of course, who was very impressed with Somerset Maugham's work and said, "You're doing exactly what I'd like to do. When I retire, I want to write novels like you." And Somerset Maugham was a generalist physician like myself, and he responded quite humorously, "When I retire, I want to practice surgery." So what was his point? His point is simply that you don't just sit down and start writing novels. You have to have some sort of skill set and some sort of experience. As someone that deals with both scientific writing and creative writing all the time, whenever and people will come into my office and I've got a great idea for a grant or a great idea for a story or a great idea for a paper, and I say, "That's wonderful. Why don't you write down what the idea is just in one page and send it to me by tomorrow morning, and I will read it." And 90% of the time I receive nothing, right? And you wonder, well, what's going on here in particular? And it's because people just simply don't know how to go about this. If I were to say, it's interesting because everybody thinks they have a book in them. In fact, there was a survey about 10 years ago, and it was published in the New York Times, that showed that 86% of American adults, that's 200 million people, believe they have a book in them. And the author humorously responded, "Please don't write any of those books." So everybody feels they can write a book. Not everyone feels they can play the piano or the violin or anything else. You can't just pick it up and start playing. So why is this the case? I don't know the answer to that, but I do know that you cannot put a group of healthcare professionals and others together and expect them to have a wonderful creative output, even though they may be extremely intelligent and have great ideas. So you need skills, and those skills can be very, very basic: grammar, punctuation, spelling, which we do not emphasize in our group at all because we have so many software programs and there's many ways to correct errors of that type. I certainly make lots of those errors. The second level is something called usage, of course, which is my pet peeve, the way a word, phrase, or expression is normally and correctly used. And the 5 C's is a paradigm that I developed for scientific writing, but I believe also applies to creative writing as well. And the 5 C's are conciseness, clarity, cogency, commonness, and consistency. So how do you promote these skills to people who are very busy? They can't do degrees. And here in the United States, there's a very popular degree called the Masters of Fine Arts in Creative Writing, which I think every small college seems to offer, with exorbitant tuition rates. There's a number of these programs in the UK as well, but that's not practical for most of these folks. So we did create something, and I'm going to stop sharing for a second because I want to share a couple of examples of what we had done here. Just give me one moment. Let's try sharing this. Okay, I hope you can see this. This is called the Right Way, the Right Word quiz. So what I did was I prescribed some readings for our group of approximately 20 people at the time. One of which is Dreyer's English, which I know is not commonly used in the UK, but I think it's quite brilliant. Benjamin Dreyer is an editor at Random House, one of the big 5 publishers, and must have a very interesting and humorous personality. But I based this particular evaluation to some extent on his book and some of my own work. And it's really, the goal here is not to teach you everything about how to write well, but to raise your awareness of your own writing so that you're careful about the words you put on a page. So here's one question that I think we'll just go over quickly. Style, smiles, and similes and metaphors. A man is waiting in a coffee shop for his younger brother, whom he learned had been in trouble with the law and needed help. Which one of the following is the most appropriate beginning of a description of this scene? In other words, what's the simplest, plainest, clearest language? I was a snapping turtle hiding in my underwater burrow, waiting for him to pass by. That makes no sense. I sat there waiting patiently, like a probation officer waiting for an update on the latest trouble. Much better. I sat like an unmovable log in a forest. I don't know what the simile there is. Always present, ever waiting for my brother to appear. Like the clockmaker of old, patience was my virtue, and I sat there waiting for my brother. So, I mean, you have to decide. I mean, it's a subjective subjective assessment for this, but probably the second choice makes the most sense. Conciseness, these are expressions that we ought to abbreviate. Fiction novel should just be a novel. Fall down, you can't fall up. Presumably, earlier in time is earlier, and horsepower is simply power. So these are the kinds of questions we ask. And I asked everyone to do the quiz, and most of them did. And again, the goal was not to teach them everything, but to be aware of some of those issues as they write. Now, so we have a baseline, and that was the idea. Let's create a baseline upon which we can build our skills. So we have got to the point. Let me take you through my journey. So I had my personal experience with writing for well-being, uncovered some evidence that it was effective, organized a group with a specific mission that was not just to find to promote wellness, but also to allow people to accomplish things that they felt were meaningful. What do we do next? Well, let's move on. And I wanted to spend just about 5 minutes, and I know I'm going quite quickly, Alice, but we're going to try to make this a little bit of interactive. So we started off, of course, some members of the group will say, well, I'd like to write a short story, or I'd like to write a novel. And the latest push is for poetry, which I have no experience with, to be honest. I'm not a poet. It takes me a long time to build characters and that sort of thing. But I have a whole bunch of prompts that I've used over the last 20 years or so, both for creative writing and scientific writing. And this is one of them, which I think elicited some really interesting responses. We got to the village quite late, nearly 7 p.m. I looked about, but didn't see anything that resembled a real village. There was a rusty tin shack hidden among the slender palms, some distance from us. We waited patiently. The elderly man who had apparently seen it emerged from the twilight about 20 minutes later and sat down on a tree stump that looked quite fresh, as loggers had been in the area only a few weeks early. He had quite a story to tell. What I'd like to do is just to see what sort of things you come up with. I do not expect you to write an entire story about this, but I want to see if you could come up with perhaps 50 words or 2 sentences about how you would continue this particular prompt, this particular story. What would be the next couple of lines that you would write? And Alice, if you don't mind, we'll give folks about 5 minutes to do that, and then we'll reconvene. Obviously, not all of you can share your work, but I'll ask a couple of you to do so once we're done. So please get started. Just about 1 minute left. Okay, let's reconvene and see what someone came up to. I know there's a number of American participants. They've seen this particular prompt before, so I don't think I'd ask them to volunteer. But would somebody else like to volunteer their couple of sentences that they've come up with? You just maybe raise your hand on the Zoom, using the Zoom feature. Okay, I've got Joe Cottrell. Joe, would you like to introduce yourself first before you tell us what you came up with?
Yes, can you hear me okay?
Yes, we can.
My name's Jo Cottrell, and I'm a children's writer, and I live just outside Oxford, in the UK. Um, would you like me just to start? I could just read it, or I can share. What would you prefer?
You can just read it.
Okay.
Interesting.
So I picked up the final sentence, which was, he had quite a story to tell, and I wanted to add to that. So it says, he had quite a story to tell, but before he began, he asked if we had any chocolate. I haven't seen real chocolate for many months, he said wistfully. After consultation with the rest of the group, it appeared that Nick, the youngest, was indeed carrying half a bar of dairy milk. He was quite reluctant to hand it over, but crumbled under the weight of expectation as we all looked at him. The elderly man ate it slowly and with great satisfaction, savouring every bite. Then he sighed. I believe I heard an echoing sigh from Nick, and smiled round at us all. I am so glad to see you, he said. Someone needs to know what happened here, and I am the only one left to tell it.
Wow, Joe, that was brilliant. You came up with that just now. Wonderful.
Yeah, I write fast.
That was terrific, and very unique for those of you on the call from this part of the world. Dairy milk is hugely popular in the UK. People don't get real dairy milk here, so they bring it back in suitcases and that sort of thing. Nina Lewis.
Hi, I'm in the UK as well, and I'm mainly a poet, but I haven't written a poem, so I'll share my sentence. His voice was gravel. I got the impression we were the first people he'd spoken to in a while. He told us about the night the village left. Doris and I stayed. We couldn't leave her, he whispered, staring at the shack.
Thank you, Nina. That was wonderful as well. So, it's always interesting to see where these stories go. I mean, some people write about monsters, etc. I know one of our writers here made this more of an environmental catastrophe type of story as well. So thank you both for sharing those. And let's move on. I just wanted to give you a flavor of the sorts of activities we've completed in Words for Wellness. So the other thing we talked about is how to give feedback to other writers. So this is a peer group. I've learned as much from our members as anyone else, and I've received feedback and I've given feedback as well. And I've attended a number of conferences for writers and others, including the Bread Loaf Conference in Vermont. And there's this whole sort of, everybody's writing is wonderful and everyone is wonderful, and that doesn't really cut it with me. That's not how I was raised. So a lot of blanket praise is really, really not helpful. So there is a paradigm. So both the responses to prompts we heard, I think, were outstanding, and probably because those are from fairly experienced writers. But what about those who are starting off? So this is the sort of feedback that I don't think is helpful. When, let's say, somebody has written a story or part of a story, that was really interesting, I enjoyed that, I really wonder what's going to happen to the character of Esmeralda. Is she really living in another dimension? And you wonder, am I really interested in this? And is that helpful? It's not helpful to the writer one bit, because they come away with almost nothing on how to improve it. The core principles of feedback have been outlined by another physician writer who wrote a very influential article about this. He's based at the University of Western Ontario in Canada. He always discusses, start with a few broad areas. Is the piece interesting and original? Ask the writer, first of all, what specific aspects they're especially interested in getting feedback about. And this is something that's very common at Iowa and Vermont as well. Okay, you've given me this short story. Well, what is it that you're concerned about? And it might be something to the effect of, well, do you think this character is realistic? Or do you think it's this, there's not enough of a description here, etc. This is my own request for feedback. All my lead characters are struggling middle-aged men who struggle with a loss of identity, broken relationships, or professional dissatisfaction. Trouble is such men don't like to read. How can I make my writing more interesting to women? So that might be something that you might solicit feedback about in a particular area. But worry about the theme, the story, and possible usage. Don't worry about grammar, punctuation, and spelling. I mean, it's very tedious for someone to read your story to correct typos and things like that. That's not the purpose of giving feedback. There are many ways to do that afterwards. Give feedback about the piece, not the writer. Okay, and that can be either positive or negative. It goes, you seem to have a real interest in environmental issues. Well, that's a positive, of course, but that's not really what you're there for. You have a tendency to use flowery language, right? Is not the way to do that, because you're giving feedback about the writer. You have a tendency. That's somebody who's pinning an identity upon you. That's not appropriate. Rather, you should say, I think this sentence could be stated more simply. Okay. As I read this, your train of thought is awfully hard to follow. Again, you don't know what the train of the thought of the writer actually is. I'm a bit confused by these paragraphs. In the first, the lead character is a little girl, and the next, she's all grown up. And don't judge the subject matter. In most of these writing conferences, and I'm sure it's true at OCLW, etc. The range of subjects is extremely broad, and you may not have a specific interest in the subject at hand, but nevertheless, you can give authoritative and useful feedback. Be specific. Never say things such as, this paragraph is a bit vague, versus, I don't understand this paragraph. Did the family go on vacation already, or are they still planning it? That's very specific. Prioritize your feedback here. Here's the most important thing you need to change, followed by the second most important thing, followed by something you may want to consider if you have time. And always end with something positive. You say, all that having been said, I think this is a really interesting story with some potential, because you don't want to discourage people either. So we actually spent a fair bit of time doing that shortly after the prompts, because that's when people started to work on their projects. Now, I'm not going to ask our colleagues here, in the interest of time, to do some readings, but we perhaps can do that at some other point. But we started off writing short fiction. And I can tell you that our group came up with some wonderful stories that improved significantly over time, with multiple levels of revision and feedback, not just from me, but from others as well. A number of folks have entered writing competitions, and I'm going to ask and see if anyone here has done so. Actually, Kelsey, would you mind just telling us a little bit about your story and where you entered it, if you don't mind?
Okay, my name's Kelsey Upholds, and I wrote a short story that is semi-autobiographical. It's about a couple of sailors who get stuck in a storm. So far, I have entered it in a local magazine called Gordon Square Review. They're based in Cleveland. It was not received that well, so I'm working on finding another alternate outlet for it, maybe with one that is a bit more based on that specific genre. It's meant to be more of an adventure slash survival story rather than a literary one.
Thank you, Kelsey. So that gives you a flavor of some of the projects we worked on. The next push, because I mean this is a group that's driven by the interests of its membership, certainly not by me as the group leader, is poetry, which is really I'm really out of my element. I couldn't tell you a good poem from a poorly written one most of the time. So we have solicited the help. The chairman of the Department of English at Case Western happens to also be the poetry editor for the Atlantic magazine, so he's agreed to help us. He hasn't done so yet, but because he's had a very busy summer, and I'm hoping that he will at least give us some tips to begin with. We have actually solicited the help of a professional writer from Texas, Michael Hilbig, who writes short stories and has given feedback to a number of our members here. Has anyone on the call, Angela or Leela, have you received any feedback from Mike? I can't remember. Anyone?
I have.
Leela, do you want to just introduce yourself and just tell us a little bit about your story just for a moment?
Absolutely. Hi, everyone. Great to meet you. I'm Leela Jacob. I'm a writer in Atlanta. I'm a little bit of an odd bird in this group. I have no medical experience professionally. I work in tech, but we've crossed paths in different ways through writing conferences. My story was a short story. I've written a few different ones trying to find kind of a good genre fit for different publications. The one that I shared with Mike was a little bit of a surreal story. I didn't end up sharing the one that I shared with group. I chose something a little bit different, chose something a little bit darker, a little bit different, and a little bit more fantasy, because that's something that Mike had shared with us, that he's written fantasy and has a good take on that. So I shared something that was a little bit closest to what he shared with the group. Got some really good feedback. I would say definitely adhering to the best practices shared in this group, not personal, nothing that was difficult to read or difficult to take, very straightforward, just good prescriptive feedback on how to simplify, how to clarify, and make the piece stronger.
Thank you, Leela. So Mike is a colleague of mine who's also a novelist, and we have the same publisher, and that's how we were able to connect. So we're kind of making, connections here and there at Stanford, obviously with Alice at Oxford, etc. So it's already 20 to, I guess your time at 20 to 1. So I wanted to leave aside a significant amount of time for questions and comments. But one of the major purposes here is, what would you like to do? I mentioned to Alice that I do go to Oxford at least once a year, and I'd like to do some workshops, perhaps around some of the activities that I've described in this short seminar. So I'll be there in March. I don't have the exact dates, but I'll let Alice know, and maybe just one day to see if people would like to get together. Alice and I have been corresponding by email for some time, and she has the same sort of vision that this could be the start of a movement, I think. So OCLW obviously has a mission that's somewhat aligned with this, but I would love to lead workshops it doesn't have to be healthcare professionals, but anyone who's interested in adding a new dimension to their career while finding some peace through writing, and perhaps the trainer type of approach that we could have as well. We are very heavily North American, as you can imagine, and we'd like to diversify our membership significantly. This is something that doesn't generate a lot of money, doesn't require a lot of money, but I think is something that would be interesting to many of you. And so let me stop there and see what your impressions are, and if we were to put aside a day or two in the spring, what you might want to do. So let me see, and you can feel free to put in some suggestions in the chat, and which I can read up to the group. So Helen states, that would be great. Could you make them available online, please? Because I don't live near Oxford, but would love to join the workshops, of course. Sure, you can do that. And Joe says, I would be very interested in being trained to deliver this kind of thing in schools, as I work with primary and secondary schools here in the UK, and there's a crisis, and yes, which I actually have read about. There is a crisis here as well in the United States of that type, Joe. That's really interesting. You know, one of the limitations we have, and I mentioned poetry in particular, is that not being a poet and not being a children's writer means that for someone like Joe, we would have to have some help on how to train. I suppose, Joe, you're referring to teachers or others who could help lead these workshops. But Joe, do you want to maybe qualify your idea?
I was just thinking as you were talking about how useful it can be to even just finding expression for things and being able to create something. I visit lots of schools as part of my job anyway, because as a children's writer, especially in the UK, there's quite a culture of schools paying less than they used to be able to, because nobody's got any money. But schools will pay for an author to come in for the day and work with the kids in the school, either delivering talks or doing creative writing workshops. And there's a growing movement, I think, in this country to start to work more empathetically with students and young pupils. And I've recently been signed up to do a year's sort of like patron of reading work across 5 primary schools. And this is the sort of thing that they might be really interested in having sessions for children that are creative writing, but are writing for wellness and health, because that also allows them to perhaps access funding pots and things, so they can actually pay for them. So it's something that I've never really thought about before in that specific terms, but might be really good to develop and explore.
Yeah, I think that's a wonderful vision. We have things similar to that here, where a writer is invited to come and speak to children in a school and does a reading, and presumably that provides some degree of inspiration.
Yeah.
But it's never a systematic program. In other words, it's not. It doesn't have any outcomes. It doesn't have any objectives. And I think what you're proposing is something more formal, which I think would be wonderful as well. And as a children's writer, you'd be very well equipped to lead that. So thank you for sharing that. There's a couple of, Antonia, I can get to Oxford with forward planning. Helen, I would like to learn how to deliver these sessions to healthcare professionals, as I work in a hospital and most NHS organizations are trying to improve their well-being resources. Well, I can certainly, that's what I do. And Helen, you and I can certainly discuss that offline, on how to organize these sessions, how to develop a mission, how to attract participants, which is perhaps the biggest challenge as well, and how to solicit the support of the NHS Trust or whoever you happen to work with. I did a workshop of this type in Leeds a number of years ago. It was very well received. I know that's probably far away from most of you. Joe, I'd be very interested in being trained to, okay, I'm sorry, that's the previous comment. My background is writing and editing. I work with a lot of neurodivergent authors. This is Antonia Reed. That sounds very interesting to me. In how people can use writing as a way of coping with grief. And that's interesting. Kamini Kanduri said, and it's a very interesting point, because several of our members have written about their experience with grief as well. And I assume that that's something that Alice's group at OCLW deals with a lot. So we've got a number of great ideas.
And we also, sorry to put you on the spot, Tamarin, but we have in the room Tamarin Norwood, who's running an event for OCLU in just a few weeks' time on this very subject, which it's a very small scale event, but if you're working in this area already, then you might want to check that out. It's not really a kind of public writing workshop. It's more to do with people you can say more, Tamara, and I'm sort of
yeah, no, thank you.
Go ahead. Yeah,
I was exactly thinking of mentioning that actually, and I'd be delighted if anyone interested in this wanted to come along. I think it's on the 5th of November, mostly online. But that is about specifically how writing practice can be brought into kind of healthcare, kind of writing for wellness, but also generally arts in hospitals and healthcare, humanities type projects, because so often these projects draw upon the processes of writing or creative arts and the products, like looking at paintings, reading texts, but don't really, I think, get to grips very well with the idea that writers and artists have practices. So if that rings a bell to anybody, that's something I'm really interested in. And that's something I'd be fascinated to talk with you more about. But I had a specific question as well, which is about reflective practice. So I don't know if it's the same in the state in Canada, but certainly in the States, I don't know, but I know I work with Australians and I work in the UK with medical students. And I know that a lot of the time where writing and wellness comes together, it's in a kind of reflective practice type context, which is fraught with all kinds of problems because actually you're evaluated on it. You could be taken to court if, all kinds of things. So have you done any work is reflective practice kind of on your radar, or is it?
It's interesting because I think, Tamara, the goals of our group are driven by the membership's requirements. And so there's not this broader system goal. It's like, oh, yes, let's promote reflective practice, which we do have. We have a center for writing and well-being at the medical school. So the medical students do participate in this. And I did myself. I'm from Canada. I went to McGill Medical School, which was kind of a pioneer in this area. We did that, many years ago. But I don't think it's been on the radar for this particular group as well. It's just like narrative medicine is a commonly, thrown around term that has different definitions. And of course, there are groups that are devoted to it. But this group is more about, yes, let me find some peace and let's find some comfort. Let me actually express myself in a way that gives me a sense of satisfaction. So it's a little bit different.
Yeah, thank
you. I'm going to go back to the chat because there's a number of other questions as well. And then we'll perhaps wrap things up. Poetry. Okay. All right. So we've got some suggestions for someone who has some expertise in poetry, which is, of course, very welcome for us. So let me wrap things up because I know that many of us have places to go at the top of the hour. But what I would like to do, I'll be in touch with Alice and this is selfish because Alice, I mentioned that I go to Oxford for a completely different type of conference that deals with health services research and healthcare delivery and that sort of thing. It has nothing to do with creative writing. Not a single member attendee at that conference will be coming to OCLW, I guarantee, except for me. So what I would love to do to spend a day or so at OCLW and do some of these workshops and get this group together. And for those of you who aren't able to make it in person, we can certainly do it by Zoom. And if we have it at lunchtime, I'm sure some of my colleagues here would be able to join as well. But we'll kind of define what it is. But wonderful ideas here. I really like the idea of making this a more systematic project that's aligned with national organizations. That's certainly something we need here as well. As far as the direction of our group goes, we are going to meet again in the fall. We've taken a little bit of a break over the summer. And we're going to solicit the help of obviously an accomplished poet and poetry editor who's going to help us get started with some poems as well. And I'm hoping that you heard from Leela and from Kelsey. Unfortunately, we haven't had any short stories accepted to literary magazines, which of course is not unusual. So for some of you who are successful writers, you know how difficult it is. It's extremely difficult. But I think people will persevere and they will be successful eventually. If not, the worst case scenario will come up with a way to disseminate our work to others at some point. So I encourage you all to email me, to contact me. I'm always available as well. So any final thoughts or questions before we wrap up? And I'll maybe turn things back to Alice at the end.
I was just going to say, if you do want people to contact you individually, do you want to put either your email or your
Yeah,
university profile or something in the chat so people can
let
grab
me
it.
do that right
There
now.
are a few other useful links that have gone past in the chat, just to flag to anyone who wants them. So I've added two, and there's one from Mariah as well. So the two that I've added are a link to Tamarin's event and a link to the Oxford Centre
Excellent.
for writing groups, of which there are there two or three? There are two regular publicly accessible ones. So you can find them on the writing groups page of our website. And then Mariah has shared a link to the article by Bethany Whittle about poetry and junior doctors, and also linked back to a conference we held at Ockley a few years ago about poetry. So do check out the chat for those links, and also we have Goutham's email address as well. So that's fantastic. So I mean, I'll hand back to you in a sec, but I do want to say thank you so much for running today's session and giving us all such insight into, you know, both what you do and also what it can achieve, because I think we all as writers have the general sense it's good for our well-being, or that we could use it as therapy or whatever it might be. But yeah, actually having that come from a medical professional, and also the structure for it, the structure for feedback as well as for writing, is always incredibly useful. So I'm really looking forward to talking more about what we might do in the spring. So watch this space, everybody, and I'll hand back over for any final remarks.
Yes, thank you so much, Ed. Thank you so much for helping to bring us together once again. This is going to be recorded, so I will send it out to all the invitees and the link. And then also, please do share it with any of your colleagues who are unable to attend. So, and please do reach out to me. I'd like to have some sort of framework for the spring, and to see what we can do and what we can accomplish in a day or a day and a half or so. And of course, that'll be more of a foundation to continue to meet regularly. Actually, it's interesting. This time actually works quite well for us. I'm also a member of the group at Stanford, as you know, but those people don't get off of work until 6 p.m. Pacific time, which is 9 p.m. here on the East Coast of the United States, which is a point at which I'm really tired. So it's very hard to lead groups at that point. So the UK actually, from a time zone perspective, actually works better. So thank you, everyone. And we'll definitely be in touch. Have a wonderful afternoon. Bye-bye.